medical practitioners and the Deputy Director of Planning in charge of Social Welfare, Antonio Suji, have applauded Sir Emeka Offor Foundation for paying off the hospital bills of some stranded and less privileged patients in the National Hospital. The Sir Emeka Offor Foundation on Monday settled the bills of about 15 patients who were on admission at the National Hospital in Abuja. Addressing the media after the medical rounds, the Vice President of the Foundation, Barrister Dora Offor, said the gesture, which was coming at the Christmas season, was meant to carry a message of love and care for the patients in the spirit of the youth child. Barrister Offor said part of the foundation's goal was to cater for the downtrodden, especially critically ill patients on admission who cannot afford to pay bills for good health care.
The Christmas season is here, and for the most part, we spend time buying clothes, shoes, bags of rice, clothes for the kids. We plan vacation, we save money to spend, at parties, at functions. There are people that don't have those plans. It's not because they don't want to, but it's because they can't afford to. They're here, they're sick, they are trying to battle illness, some are healed, and then some are stuck, and they're stuck here because they can't afford the medical care given to them. And so they're here. It's a very humbling experience. I had a very humbling experience today, I'll tell you. It makes you think and wonder what you really spend your money on. If those things are worth it. So yes, I bless my husband really for his suggestion and commitment to coming here today. I am really so thankful that we're here today. Our entire team, we're thankful. For us, this has been it's quite a very humbling day. I know there are a lot of people that, the situation would have been better if they could afford medical care. And for those that have been able to brave it enough to come here, they're here. They can't go home. It's an experience I can't explain, and I'm thankful that we're here.
She revealed that over 15 lives were touched during the course of the visit, adding that about 2 million naira had been spent so far in offsetting the bills of some of the patients. She added that there were plans by the foundation to reach out to more patients in the hospital. Commending the show of love for the ill patients, the management of the hospital applauded the gesture of CIOF delegation. The Deputy Director of Planning in charge of Social Welfare, Antonio Suji, said that the foundation had demonstrated what show of love and selfless service should look like.
We are very grateful for the touch of life from this foundation. Actually, it's more of a humanitarian service. And it's when you come to hospital, you see that you will feel the nature has favored some against others. So it's a welcome development. And instead of taking this money out to other things, he has used it to save life and humanity. The hospital management we are very grateful, and we like many people of this church to come to hospital also to do the same for the poor people and for the less privileged. And if you see, it's not about the money. The gesture has actually helped. Even some of them will even get well from this gesture. Even if they're not discharged, from this gesture they will be discharged.
The matron in charge of the inpatient pediatric unit, Helen Ada, said some of the patients whose lives were touched by the foundation had illnesses ranging from typhoid, perforation, severe burns, and inguinal hernias, a bulge or swelling in the groin or scrotum.
I do appreciate this foundation that have come to put smiles on the faces of my patients. It's not an easy task, and I ask the good Lord to bless and replenish wherever you have put your hands to make these children smile and their parents to give them relief. The patients you have actually come to see, like Mohammed Abubakar, he had a typhoid perforation, and he had intestinal obstruction, and he was taken to theater for emergency laparotomy. He did that, and then he's been placed on a TP end. He's actually feeling better on IV antibiotics. The Elusia Benjamin had burns from hot water. He actually came in here and was so very sick with fulminating infections. He had septicemia, but thank God he's getting better. This money you have given will bring a lot of relief, and then as the child is going to theater now, he will have it, he will feel better.
The benefactors of the gesture appreciated the foundation for saving their lives and giving them a reason to live again. Annie Patrick, Core TV News, Abuja.